Brain tumor signs and symptoms are often very different from other cancer and other tumors, and there's a reason for it. And that's the reason why I have brought this little friend of mine, which is a replica of the human skull. So you can see that the skull has a vault and it's got these bones, and the brain lies in here. So this brain lies in here. Now, the bones are quite hard, and in a grown-up person above the age of 1 to 2 years, these bones are fused. They're all combined into one vault which holds the brain. There's no room for the brain to expand in here. So when there's a tumor, the tumor puts pressure. Now remember, tumors, whether they are benign or malignant, they are all new growths in the brain. And they try to grow more and more, and they compress on the brain inside, and there's a swelling around the brain. When there's a swelling around the brain can't expand, and it pushes against the lining of the skull, the vault of the skull. And those pressure symptoms lead to headaches. So one of the very early signs of a brain tumor is headaches. If the tumor is fast growing, the sign would develop quicker, and it is going to be more intense. If the tumor is slow growing, the brain might adjust to it, and the symptoms of headache would not be that prominent. Along with the headaches, the second common sign of brain tumors is that the patients develop symptoms of nausea and they end up with vomiting. Now, nausea and vomiting after headache are one of the most common symptoms and signs of brain tumors. The third common sign and symptom of brain tumors is seizures. Now, the brain tumor, when it is growing in the brain, it is going to disrupt the function of the brain. And that disruption can result in fits, which are also known as seizures. So headaches, nausea, vomiting, and seizures. These are the 4 very common signs and symptoms of brain tumors. At times, the part of the brain where the tumor is growing would have a particular function. For example, it could be speech, or it could be hearing, or it could be movement or sensation. And when the brain tumor is pressing on that part, that function is affected. So these are known as focal neurological deficit. So it's basically a deficit of the nerve function of the brain. So people might get different sensations or a lack of sensation. They might get loss of power or loss of function in any part of the body, the hand, the arm, the leg, or they might have effects on their memory and their speech or hearing. So whichever part of the brain is being affected by the tumor, the pressure buildup, that function is going to be impaired.